Hey everybody, this is Jim Prusak, physical therapist from the Pain PT, and today we're going to talk about shoulder imaging findings and what's the relationship to pain. I've gone over the other joints and we looked at the research evidence that shows many times a lot of changes that we see on X-ray and MRI are not directly correlated with pain and are mostly age-related degenerative changes. And especially when it comes to chronic pain, we need to be really careful with how we look at these results. So let's get to it here. First study, 2014, looked at adolescent athletes, shoulder MRIs. All these athletes didn't have any pain, asymptomatic. And what they did is they found that 46% of them, almost half of them, had abnormal findings in their tendons. And 52% of these baseball players had 17 positive MRI findings in their throwing shoulder that were not present in their non-dominant shoulder. So this kind of makes sense. You know, these two studies here, you're using the arm a lot more. It's creating some strain and stress. It's creating tissue changes, yet they had no symptoms at all. So again, here a 5-year study, overhead athletes again, took MRIs of the shoulders, their dominant shoulders, and they found that 40% had partial or full thickness tears of the rotator cuff compared with 0% of their non-dominant shoulders. Now again, remember these athletes had zero pain, no symptoms. 25% of the shoulders had evidence of what's called Bennett's lesions, which is a common thing we see with overhead athletes, compared with 0% of their non-dominant shoulders. What was interesting though, because they followed these people for 5 years, they interviewed them later, and none of them had any subjective symptoms, nor had required or needed treatment for the shoulder findings we saw here. So what is this telling us? It's telling us that these findings are quite common and we see them often, but they're not always directly related to pain. So how common are rotator cuff tears without pain as we age? This was a study done with 400 plus people. All of them had ultrasounds of the shoulder. And if you look at the data here based on the age category, you can just see the percentage of rotator cuffs goes up as we get older, similar to what we saw in some of the other body parts like the spine and the knee and the hip. And the authors here, their quotations and their results and conclusions was this: an astonishingly high rate of rotator cuff tears in patients with asymptomatic shoulders was thus demonstrated with increasing patient age. As a result, rotator cuff tears must, to a certain extent, be regarded as normal degenerative attrition, not necessarily causing pain and functional impairment. So this is pretty powerful for the authors to come out and say that a lot of times these are just normal changes. And that's exactly what we're showing here with the data. So again, here's another study, ultrasound of the shoulder, asymptomatic findings in men, 50 subjects, aged 40 to 70, no pain. Just look at all the findings here of different tissue changes that are found in these participants here. There's quite a large number of changes, and their conclusion again is asymptomatic shoulder abnormalities were found in 96% of the subjects. So we see the things often. It's like getting older. It's like getting gray hair. It's like when we do something and we use an arm, a shoulder a lot, there's changes in the tissue, as we saw in the younger athletes and overhead athletes. And they basically say that ultrasound findings should be interpreted closely with clinical findings to determine the cause of symptoms. And especially when we're looking at chronic pain, we need to look very closely because we know the evidence is quite strong for the link between the brain and pain, and not nearly as strong as you're seeing here between structural changes and pain. So let's look at some older adults. Osteoarthritis changes and changes in the shoulder as they age. All these participants here, not all of them, but most of them had no symptoms. They looked at 3 different groups: people with current shoulder pain, no shoulder pain, and then previous shoulder pain. And what they found was an X-ray, there was no difference between the groups in terms of the changes in the shoulder. The tendinosis and rotator cuff tears were present in the majority of participants in each group. So even though people who've had current shoulder pain, previous shoulder pain, or no shoulder pain, the changes were the same. So the conclusion again, shoulder pathology is apparent in both symptomatic and asymptomatic shoulders, and clinical symptoms may not match radiological findings. The cost burden of ordering MRI scans is significant, and the relevance of the findings are questionable when investigating shoulder pain. Quite powerful stuff. 2014 study. We're going to look a little bit more. This is the last study here. This is done more recently. 2018 was a systematic review, meaning looked at all the research out there, looked at over 6,500 research abstracts and studies in relationship to imaging findings of the shoulder with shoulder symptoms. Here's the bottom line. Their conclusion was this: there was no significant association between most imaging features and symptoms among high-quality cross-sectional studies. Based on these studies, enlarging rotator cuff tears were the only thing associated with increased incidence of symptoms. So if we're seeing a real large or enlarging rotator cuff tear, that is associated with pain or symptoms in the shoulder. But otherwise, they didn't find any significant association. So basically, they go on to just say this. They say structure-pain relationships are complex. There's the possibility that there may be no relationship between imaging findings and symptoms. And there's other factors that may be at play. And some of them are to do with the body. Some of them are to do with aging, the sex, your weight, activity, mental health, and central sensitization. Central sensitization is the brain, and that's what we talk a lot about with chronic pain. So I hope you gathered and learned some information here about the shoulder if you're dealing with some chronic shoulder issues, and hopefully it was enlightening. Please check out some of my other videos at the YouTube channel, The Pain PT, and I hope you have a wonderful day. Thank you.